Everyone, welcome to Gut Over It. My name is Dr. Vivian Asamoah. I'm a gastroenterologist in Katy, Texas. I'm also a functional medicine provider. Thank you guys for joining me tonight. If you're listening live, go ahead and please leave some likes, share some love, leave some comments. This is a great one to ask questions for. If you are listening to this on the replay, enjoy it, share it with friends and family, and let me know if you guys have any questions, okay? Tonight, we are going to be talking about food allergies. I don't see my timer going, so if everything is syncing well, if someone would just leave a little comment to let me know that you are hearing me okay and that everything is syncing well. If not, also let me know because I don't see my timer going, but I think I'm good. I'm going to put in a little question. There we go. Perfect. I see it running now. So tonight we're going to be talking about food reactions. And this is a really great topic because a lot of people are getting information from their doctors, from resources through social media, kits being delivered at home about, do I have a food allergy? Do I have a food sensitivity? And these kits are not always covered by insurance and can be pretty expensive. So it's important to know what you're getting yourself into. And it's important to know, hey, it's important to understand why you're doing the test. If there's one take-home message that I'd like you guys to get out of this is at the end of the day, food is not your enemy. Food has to become your friend. The whole goal is for us to be eating most foods, most healthy foods, unprocessed foods, foods that have the right nutrients in them. We have to become one with food again. Now, there's some foods that some people will never be able to eat, either because of allergy, sensitivity, or intolerance. But for the most part, you want to always see a provider who is trying to get you eating again and not over restricting. Because we are in this phase of medicine right now, especially with functional medicine, especially with a lot of information being out there and available to people. Patients don't know what to pick. They don't know what's right. And a lot of our patients are losing pounds and pounds and pounds and pounds and losing muscle mass because they are over restricting foods. They are doing food allergy tests that's showing 20 different foods, 40 different foods. And sometimes it's even hard to know what that sensitivity is and which food it's in. So they just over restrict everything. So in my functional medicine practice, I see a lot of people who say, I have seen nutritionists, I've seen dietitians, I've seen other providers, and they've told me not to eat this 10-page list of foods. So here I am, Dr. Asamoah, what do I do? And they feel tired because they're not getting enough food, they're not getting the calories, they've got brain fog, they're not doing well. And so as a functional medicine provider, I think one of my missions as a gastroenterologist, as an integrative gastroenterologist, is to help people who have chronic gut conditions, who have tried conventional medicine and testing, and who are seeking for a more holistic, integrative approach, right, to heal and have a great relationship with food again. So this is a great one to share with people who you may know who may be in that kind of situation. It's a complicated topic, but I think I can simplify. We're going to break it down. Overall, when you have an issue with food, it's called a food reaction. That's what we call it. The first type of food reaction is the most common one. It's the food allergy, right? It's the IgE mediated. So they're immunoglobulins that are produced in response to a reaction, an adverse reaction. And so these basically defend your immune system. So if they don't like something, they produce a type of immunoglobulin to fight it, right? And so you have immunoglobulins that are produced in an immediate reaction and immunoglobulins that are produced in a delayed reaction. We're gonna try and keep this simple so I keep everyone's level of interest. And if you guys have questions, ask. The first food reaction we're talking about is food allergy. This is IgE mediated. This is what your allergist is gonna pick up on blood work and on skin test, okay? This can be done for seasonal allergies like pollen. It can also be done for food allergies. This is when you eat strawberries, peanuts, what do people have? Walnuts, and you immediately start itching your throat, you break up in a rash, you can't breathe, or you go all the way into anaphylactic shock and you need that injection. You need that EpiPen. You need Benadryl. And when you take EpiPen and Benadryl, everything goes down and you are better. Okay? So that is number one. Food reaction, IgE mediated, that's different. That is a food allergy. Okay? What is really interesting about food allergy and why I always tell patients to start with the allergist first. With the allergist, you go see a great allergist. It's covered by your insurance. They can at least do a detailed IgE blood panel. They can also do skin testing. But the relevance for me in doing seasonal, so pollen allergy, as well as food allergy, is that there is an inhalant cross reactivity. So we see patients who may have a birch tree pollen sensitivity. They can have cross reactivity with food groups because the bees that pollinize also pollinize those food groups. So we'll see someone who has sensitivity to birch tree also have sensitivity to hazelnut, to apple, to other foods that may be cross-pollinated. So it's really important. I gather a lot of information just even from seasonal allergies and the way it can actually affect cross-reactivity with foods that your doctor may not even detect, your allergist may not detect. So we've talked about that, and we've talked about the cross-reactivity. Very important, easy tests done by blood work, done by skin testing, not always 100% specific or sensitive, not always. Sometimes it'll fail to miss some important information. So keep that in mind. It's not 100%. Hey guys, glad to see so many of you are online tonight. That is wonderful for Saturday night. This is a great topic. This topic should actually be a full 45-minute lecture, but I'm going to try and keep it simple and give you guys some pearls that you can share with your doctor, share with people you know who may be suffering from food reactions. Let's move on to food intolerance. We've talked about these in our previous gut over it's, right? We've talked about intolerance to dairy, so lactose intolerance, fructose intolerance. This is where your body just does not tolerate it. You don't have the enzymes to break it down. And when you eat it, it makes you gassy, it makes you uncomfortable. Intolerance even goes beyond just lactose, fructose, sorbitol, sucrose. We see intolerance to specific food types, histamine intolerance, salicylate intolerance, oxalate-rich foods like blueberries. Some people have an intolerance. This is not an allergy. This sometimes we'll see salicylate and oxalate and histamine intolerance when you've got leaky gut and you have dysbiosis because of the immune response. And when that is calmed down, that intolerance goes away. Now keep in mind, one that you guys probably already know about is those high FODMAP foods, fructose, oligosaccharides, polyols, those high FODMAP foods that make you bloated, that's also an intolerance. So someone can say, I have an intolerance to high FODMAP foods. That is a food reaction because when you eat those foods, you get gassy, you're uncomfortable. So those are our groups of food intolerance. Fructose intolerance because you don't have the enzymes, lactose intolerance, but also intolerance to food groups. It's not an allergy, it's an intolerance, high oxalate, high salicylate, high histamine, FODMAP. I'm even thinking of tyramine, which gives people headaches. We see that a lot in aged and fermented foods, cheese, dried foods. It's an intolerance because of a reaction that occurs in your body. So that's number 2, food intolerance. And now let's go to the one that's actually everyone worries about, and that's food sensitivity, right? So this is not allergy, it's a type of allergy, right? But it's a sensitivity because the response is through a different type of immunoglobulin. This is immunoglobulin IgG. Remember with allergy, when we said go see the allergist, it was IgE. Maybe we can say it's Eve is for excited. That's the one that happens right away. You know, you get that bee sting, excited, it just hits you. But IgG is delayed, right? It is much delayed, and sometimes we'll see reactions to IgG sensitivity. The half-life can be up to 23 days. So it could be a food you ate 2 weeks ago, last week, that gives you this IgG-mediated reaction. And very often it's kind of a gruesome, lingering, smoldering reaction like, I'm bloated, I'm nauseous, I feel tired, I have brain fog, I itch, this rash just popped up, I'm having loose stools a couple times a day, what's going on? And it's going on for days and days and days, and you realize I have an upset stomach, I ate something. Or it could just be, I have this rash that just, popped up here and then popped up here and popped up there. This is an IgG mediated food sensitivity. Now, when we look at the IgGs, science, they always make it more complicated. You can even break it down further because there are 4 subtypes of IgG, subclasses. There's IgG1, IgG2, IgG3, IgG4. The ones that are really important to remember is IgG1, IgG4. The most common ones that we want to look at for that delayed sensitivity, okay, delayed sensitivity reactions, IgG4. Now, what's important in terms of delayed sensitivity reactions is that when you eat these foods, because of the half-life, when you try and eliminate the food to see whether it actually reduces your symptoms, you got to eliminate for at least 4 weeks. So 2 days, 3 days won't do anything. You may still have reactions. The complete difference with food intolerance. If you stop eating dairy because you have a lactose intolerance for 2-3 days, you'll notice an immediate effect. But with the delayed IgG mediated sensitivity, you gotta eliminate the food for a prolonged period of time because of the half-life of that inflammation in your body. 4 weeks is your minimum time, okay? Now let's talk about testing with IgG. IgG testing has not been approved by the National Allergy and Immunology Association. It has not. It has not. They don't feel that these tests are validated. We do offer them in our practices. There is more research, supportive research coming out on them, but that's the reason why they're not covered by insurance. The National Allergy Association do not believe that these tests are reproducible, and they do not believe that these tests are validated, and that's why they're sold in kits, but no one is verifying, which can be dangerous, because if they're not measuring the right type of IgG and they're not interpreting it right, and you don't have somebody who's knowledgeable that's helping you interpret, you could just be avoiding all sorts of foods. And I'll tell you why. As a gastroenterologist and as a functional gastroenterologist, I noticed that when patients have leaky gut, have SIBO, small intestinal bacterial overgrowth, have dysbiosis, have autoimmune conditions like a new diagnosis of Hashimoto's or a new diagnosis of PCOS, or have hormonal imbalance, it affects the intestinal permeability. It leads to leaky gut. Leaky gut means you've got a break in your Lego building blocks. You've got passage through, and it's almost like every single food that you eat appears to be an antigen, and your IgGs react to all of them. So if you do a test when you don't have a root cause diagnosis, but you're just saying, could it be a food allergy sensitivity? And you do a test, your test result may pop up red for major food groups. And it just means that you've got leaky gut. You're reacting to everything. You're not allergic to these foods. You are sensitive because your gut is sick and your gut needs to be healed. You guys feel me? You understand what I'm saying? So the problem is when we see patients like that, they're like, I do not eat the 100 foods. I don't know how you can do that, but they're like, I don't eat 100 foods. I have lost 50 pounds. I feel tired. I can't function. Is something else going on? And I'm like, girl, you just need to eat. You need to eat some food. And so what we need to do is figure out which one is truly, what is the root cause? Let's fix that first. And then let's figure out what are the pro-inflammatory foods that we should get rid of. And the ultimate goal for every provider should be to bring as many non-inflammatory foods back to your system. Because if your system is popping up that, I don't know, like broccoli is a problem, well, that's kind of a problem, because we know broccoli is a cruciferous, right? It's a high FODMAP food. But we know that broccoli is rich in a lot of antioxidants and a lot of nutrients. And we would not want to eliminate broccoli from your diet for the rest of your life. Remember, guys, it's all about being able to eat that rainbow diet, right? People in the blue zones who live forever and ever and ever, they eat that diverse rainbow diet. So over restriction hurts you. It's helpful for a short while, but it can help you. It can hurt you. So let's talk about IgG testing. When it comes to IgG testing, which one is good, which one is not? I don't want to mention any companies, right? Because I don't think it's right. I haven't done that much research, but I know that there's some tests that will there's something called like mediated response testing, mediator release test, otherwise known as LEAP. Okay, I said it. There's another one that looks at ALCAT. It's so they kind of look at how your white blood cells react to different foods. those tests haven't really been validated. There's a lot of controversy around leap MRT testing, around ALCAT testing. There is some recent good data on ALCAT testing for IBS, right? But in a way, you could just say go on a low FODMAP diet. So these are not IgG tests. Leap MRT and ALCAT are not IgG mediated testing. The data is actually supporting the use of IgG testing for food sensitivity. Again, IgG testing for food sensitivities, okay? So find a lab, and you guys know you're getting this information. You can read, you can ask your doctors about it, you can ask your dietitian, why are you doing this test? What is the science behind this test? How does it work for me? And I heard on Gut Over It that IgG is the one that has more supportive data, even though it is not a test that's validated by the National Academy of Allergy and whatever. They'll get there, like in a lot of things in medicine. You know, the naturopaths knew it first. The chiropractors have good information. The conventional scientists want to see more and more data, but eventually they'll get there, as we know that these approaches are helping our patients. So IgG testing is kind of where you want to go. And the best quality test with IgG testing will sometimes subgroup it into IgG1 to 4, and also look for immune complexes. We're getting into very scientific terms here, but immune complexes for IgG, and also look at raw foods versus cooked foods, because there can be a difference. So there's an excellent company, and I think they're top of the line, that does IgG testing, and they look at raw foods, they look at cooked foods, they look at food additives, they look at everything, and it gives you excellent information. And I find that their results are quite reproducible. And if you want to know the name of this company, let me know. I will send you the information. I'm so big on food sensitivity testing because it's a big part of my practice. And so step by step, what I generally tell patients is, let's define whether it's a food reaction, okay? Is it an allergy for which you need Benadryl, steroids, or EpiPen? Possibly see your allergist. Get the insurance covered full testing, blood and skin tests. Number 2, tell me more about your symptoms. Is this a food intolerance, right? Is this more a lactose intolerance? You can do testing for that, but you can just figure it out by asking the patient. Is it a fructose intolerant? Is it an oxalate intolerance? Is it a tyramine intolerance? Is it a salicylate intolerant? Is it a histamine intolerant? These are not allergies. These are intolerance, because there's something going on in the immune system and going on in the gut. And they say no, or is it a low IBS, low FODMAP? No, okay, put that aside. So we knocked out allergy, we knocked out intolerance. Now let's talk about sensitivity, right? We know there's IgA sensitivity, less important at this time, but is it an IgG mediated sensitivity? What kind of testing can we do? And I will tell you, in my practice, I'm so nerdy that I will go as far as begging some of these companies. I'll have one patient do a test with one particular IgG company, and I will have another company give a free kit. And I want to get both results at the same time, and I want to compare. And I've done this over years in my practice, and that's what's helped me pick 3 top companies that I find I always get consistent results. Like, I'm like, oh, wheat was allergy here. Oh, wheat was allergy here. But if I start seeing completely different results, it's a red flag for me. With every test that your provider does, with every test that we do as scientists, we want it to be reproducible to a certain extent. If not, $400 or $500 down the drain. Even if it's $200-300 down the drain, not worth it, right? Not worth it. And so we do that kind of testing. So one thing I want to bring back to is, when we talk about food intolerance, we talked about histamine, tyramine. I want to add to that nightshades, like potatoes and bell peppers and aubergines. That's also an intolerance that usually comes with inflammation in the body, right? It's not an allergy. It's an intolerance. It's a food reaction, and it's an intolerance type. With food additives, it's also an intolerance, right? It's an intolerance to a food additive. It is not an allergy. Those are difficult to test for specifically. But when you talk to a patient and you get a very detailed history, you can see you're like, oh, she's mentioning all the oxalate foods. Maybe she has an oxalate. She's mentioned high salicylate foods. Maybe that's it. She's mentioning high histamine foods. She has a histamine intolerance. And then you can work with the patient to now drive back to root cause and figure out what's going on. So I wanted to really focus on the different types of food reactions. I wanted to make sure that I explain this in very simple terms. So when you have this testing, you understand what you're testing for. I also want you to know that with allergies, IgE, you can't eat that food. But with intolerance, you can avoid for a certain time, fix your gut, and see if you can eat that food. And with IgG mediated sensitivity, you have to avoid that food for at least 4 weeks, if not longer. The bottom line with all three of them is that they all lead to leaky gut. They all result in inflammation. No matter what type of food reaction it is, it causes inflammation and the immune gut system is affected. It causes inflammation and causes intestinal permeability. Then you have toxins and microbial products seeping into your bloodstream. And this is what can cause systemic issues, can affect your mood, can cause headaches, can cause acne, can cause skin rash, can cause alterations in your cycle just from eating types of food. So the gut is so important, can cause so many things. But bottom line is understand the test, understand what type of food reaction it is. Do not over restrict, okay? Restrict only what you need to restrict for a certain amount of time. Now, of course, if you have autoimmune disease and it's quite active, avoid pro-inflammatory foods, right? You should avoid them, but you're not allergic to them. And if you do eat it in small quantities, 2-3 years down the road when your inflammation is reduced, great. However, if you eat the food like gluten and it causes inflammation and it causes irritation and it makes you feel bad, don't eat it. But you always have to replace. I always say, you're not eating this anymore? Let's find an ancient grain that we can replace this with. Let's find another type of vegetable that we can replace this with that will provide you with the nutrients. Because bottom line, the way I treat is identify the issue, treat the gut, treat the root cause, replenish the mucosa, fix the leaky gut with things like zinc, vitamin D, vitamin C, glutamine, treat SIBO, or which is small intestinal bacterial overgrowth, or SIFO if it is there. A critical supplement that's extremely important in all food reactions is EPA, omega fish oil. It's extremely important in building the membrane of that intestinal membrane. So make sure you've got a good quality omega fish oil. If you need some help, information about which one to, I give it to, so my son has type 1 IgE mediated allergy. I told you guys about his egg and everything. He's on fish oil every single day and it has helped him a lot. He also has eczema, so he's atopic, so it's helped him a lot. And then work with your physician, your dietitian, your nutritionist, not to over restrict, but to restrict with purpose, eliminate with purpose, reduce inflammation, and start bringing foods back. At the end of the day, you have to have a great relationship with food and use food as medicine. There's a question where someone says, is there a test that can determine inflammation in the body? There are some blood tests like CRP, C-reactive protein, ESR. Sometimes positive, sometimes not. There can be inflammation, but that test is still negative. I think the best way to determine inflammation in the body is when my patient tells me, my joints are swollen, my face is puffy, I feel tired. Those are those old clinical signs that tell us that there's inflammation in the body. So getting a good history from your patient, really taking the time to talk to your patient, get a great history, that's the best way to determine if there's inflammation in the body. But sometimes you can see it. You can actually just examine a patient and see that there's inflammation going on in the body. Absolutely. So basically, guys, I think that is all I have in terms of allergy. I talked about, in terms of IgE mediated allergy, nowadays, in addition to the vitamin D and the zinc and everything, allergy shots, I see no contraindication. We actually also have sublingual immunotherapy that can be prescribed by your allergist. I have had excellent results in my patients who've had food sensitivities, IgG mediated, right? And we found like a birch tree allergy, a maple tree allergy, seasonal, and they actually got allergy sublingual immunotherapy. And they noticed that the food allergy to apples and the cross-reactive plant foods went away. So fantastic, amazing results there. Absolutely amazing results. So I'm a big fan of sublingual immunotherapy. I think it does work pretty well. There's a lot of data on it. And if you have a good allergist, this is something they can definitely help you with, as well as if you opt to do the shots, right? Let me see if there's anything else that I wanted to share. I think I got it all. I think we got a lot of great information there. If you'd like to learn more, just ask me questions. I would love to share more. It's a very interesting topic, evolving topic. And again, let's heal the gut first and let's get back to eating healthy foods again. Do not over restrict. If you're over restricting too many foods, we have not found the solution, and that's not a way of life, okay? Again, my name is Dr. Vivian Asamoah. I am a gastroenterologist and functional medicine provider in Katy. My dream is to just practice functional gastroenterology because there is so much evolving. I mean, it's a revolution in medicine right now in terms of functional medicine and the science behind it and how it affects the gut. That is what I really want to focus on, helping patients with chronic gut issues who've tried all conventional testing, are out of ideas, no solutions, and want to get healthy again holistically, using integrative medicine and using food as medicine to heal. We'll be back tomorrow night. I got to think about what I'm going to talk about tomorrow, but we'll be back tomorrow night for a short topic because it's Sunday. And I thank you guys so much for joining me. Share this with someone who has food allergy sensitivity or is confused about what to eat. Share this with them. And if you guys want more information about the tests, the 3 tests that I have researched, done my detective work on, and love to use in my practice because I found consistent and very helpful results, send me a message and I'll send you the name of these tests. Have a wonderful Saturday, guys, and have a blessed Sunday. Bye-bye.